What's a C1 adjustment? We have a comment here from one of our videos asking, is that a C1 adjustment? Because it shows us doing an adjustment in the video. And why does Tom have this kind of bottom hand, which looks like exaggerates or it twists, and asking if this is safer than using an activator. First, before we get into the differences in the techniques and which is better, not safer or not, let's talk about what exactly is a C1. So in your neck, we have these different bones. We call the cervical bones, hence the C, and we have 1 down through 7. So again, 1, 2, 3, all the way down to 7. C1 and C2 are the ones at the top, and they're known as the upper cervical spine. And they're a bit different because they have a different shape compared to the others. So we have an example of a skull here, and we have the spine, the neck. So that top area we have here, your C1, that's the first bone. And underneath we have the C2 here. And these ones are a bit different, they're a bit unique, because these ones have a different shape compared to the others. So here we can see those different shapes. And again, it's a bit complex to try and get into a video, but essentially the way that they fit together is different compared to the other ones lower down. They do not have the same kinds of joints, and they also don't contain discs. Because of the way that they move, it means a lot of the movement from your neck, both for rotation, for side bending, and for going forward and backwards, a lot is coming from here. Some studies suggest that it may be 50% or more of all neck movement is happening here. So you can think of it a bit like this very important hinge. However, because there's a different shape of it, it's also not quite as stable as some of the joints further down. It's not being locked in place by what we call facet joints. And because we don't have that facet joint or the facet joints on either side, it means that things can potentially shift more out of place if we have bad postures, habits, sleeping positions, accidents, injuries, traumas, and all these things may be worse or made worse by stress or fatigue. When we're talking about an adjustment for C1, this would be where there is, based on testing, based on x-rays, based on other findings, a misalignment of the joints in this area where things are showing to be more out of place. That starts to have a neurological effect on the body, which may or may not be causing symptoms. It can also be based just on tests. And if there is that problem, of course, we want to do what we can to help with the alignment, reducing the irritation that may be on the nerves and the surrounding tissues, including the muscles, because that will lead to an improvement in somebody's health, again, with or without symptoms. So to do this is not something that we should be doing just by maybe trying to pop and crack our own neck, because that's not going to be accurate. If anything, it's probably going to make it worse. This is where somebody who's more trained, such as an upper cervical chiropractor, should be doing techniques in this area based on their training, based on the protocols, based on the testing they're doing, to know exactly where they should be doing to give you more accurate, focused care. The techniques for this, as mentioned, will be called upper cervical care techniques. So this is essentially an umbrella term for various different techniques that can happen at this top level. So here at Vitality Chiropractic, we practice what's called knee, chest, upper cervical technique. So essentially it's where we have the chest on more of a kneeling position, and there'll be a small push coming down. I'll show you in a video in a second. But there are also other techniques like, say, Nuka. There can be activator techniques, there can be drop heat techniques, or there can be Blair techniques, which is what I think is probably being referenced in this comment. This is an example of what we practice here at Vitality Chiropractic. This is knee, chest, upper cervical specific technique. And this, as you can see, the patient is in a kneel position. They have their chest on the bench, hence the name, and we're focusing on that C1 or C2 area like we were talking about. The head is in a fixed position. It's no big twisting, popping, or cracking of the spine. This makes things very stable, and it's what I found to be most effective for our patients. This is an example of what we call a Blair adjustment. It's a type of drop adjustment, very similar, except the person now is laying on the side. We're still focused on the C1 and C2. It's something I trained in as well. But as you may notice, it may just look a bit different in terms of technique. We have the big twisting movement like this. When talking about that exaggerated twist, I'm guessing that's probably what was being talked about here. And you can see in that video where the person is doing this very big spin movement. As I mentioned, this is Blair. This is something that I trained in as well. It's a different type of technique, but again, all under that umbrella of upper cervical, focusing on that top level. For some people, it's going to be more of a drop down. In that case, they use more of a twist. The reason for this twist is because it's trying to create more torque into the joint. And that's T-O-R-Q-U-E, not torque like I'm talking right now. And the reason why that torque is getting into the joint is to try and create more movement, to have a better change with the person, so that ultimately they have better health and improvement in potentially their symptoms or whatever else may be happening with them. We're talking about torque in that area. It's not really saying that it's actually like twisting the bone, because realistically there's a lot of muscles and other tissues in the middle, but it's more about that twisting movement of your arm, because the faster your arm moves, the more that you're getting a clean motion, which means you should have a better impact on that area. The other thing you asked about there was about the activator, the hand clicking activator. So that would be a device just like this. And in some cases, we do use this for our patients if, say, someone is much older or much younger, as they may be a patient we need to be more gentle with, such as if, say, we see a young infant or maybe, someone who's 90 years old, maybe they have slightly thinner bones. Using a hand correction, even though it's going to be very good, is still sometimes something we would want to avoid. Or if someone, say, maybe has facial pain and we want to be more sensitive with their case, because if we were put too much pressure on that area, and if their pain was on the right side of the face, as an example, then it could cause them more pain. Of course, we don't want to cause that. All this does is essentially it's creating that impulse, kind of similar like our hand would be, but it's going to be just from here, and it's going to be a very small movement, something you can barely really even see on video. And it's got a little gauge here so that we can make it more of a movement, which you may be able to see like that, or even less, which honestly, if it's at the very lowest level, is going to be extremely gentle. So these would be some of the different approaches to upper cervical techniques to work with that C1, that C2 area. But to be very honest, as long as you're going to see somebody who is very well trained, they're doing the proper kind of protocols, they're taking the proper tests, like say x-rays and nerve scans, honestly, all work very, very well. It really just comes down to practitioner preference. For me personally, because we were doing more charity trips, particularly pre-COVID, I found that it was better to do something for me, like knee chest, because I felt that for number one, we wouldn't need to, have a lot of equipment, not even say something like this, but if you're doing something like say Atlas orthogonal, it requires a very big piece of equipment, which is quite hard to do. And it's something where I could see for my patients where I was getting better results, even though I've trained in different upper cervical techniques, including knee chest of a couple of different variations, trying to do different variations with Atlas orthogonal. I have some of the notes from them, working with Nuka, doing Blair studies as well. So it's just for me what I found was best for my patients. If anyone has any questions, drop them down in the comments or let me know. If you're looking for an upper cervical chiropractor near you and you're not based here in Singapore, I'll do my best to find someone that can help you.